public hospital versus private hospital, which is always a spirited conversation. And you know, a lot of the time at this stage you've already made your choice, and maybe you're thinking, oh, you know, I have to spend a long time waiting in a public hospital, or I chose the public hospital because I really wanted a water birth, but you know, maybe I'm thinking of what my other options are. But just very broadly, if you're not quite aware of the differences, how would you best explain, say, a private hospital booking admission?
Sure. Look, I think probably the biggest thing with private that everybody knows about is picking your own obstetrician. So we're the ones that are there with you for every antenatal visit and there for the birth. But there are a lot of other differences with public and private hospitals. So, you know, in a private hospital, you'll have a midwife who's with you throughout the whole labour. Your obstetrician is kept up to date throughout the labour and will come in as necessary. Obviously, your obstetrician will be there at the birth. But you'll also have access to fully qualified anaesthetists, paediatricians who have completed all of their training, who have been working for many years, who are able to come and help with things like epidurals, looking after your baby. And I think probably one of the biggest differences that I see between public and private is the aftercare. So in private, it's pretty routine that we would encourage women to stay for around 4 nights after a normal delivery, 5 nights if they have a caesarean section, and that time is actually very useful to spend time with the midwives who are looking after you, to actually learn how to look after your baby, learn how to breastfeed, learn how to give them a bath, and feel confident by the time you go home. Whereas in public, obviously the demands are a little higher. There's more pressure for women to go home early and not necessarily with all of that same support afterwards. For some people, it might also make a difference that in a private hospital, mostly it's set up so that your partner can stay with you during the duration of your stay as well. Whereas in a public hospital, you might be sharing a room with someone else, and it's much harder for partners to stay. So, you know, having that extra support around you afterwards, I think, is probably one of the main benefits of private practice. I mean, we're wonderful, but there's so many other parts to private practice as well.
And look, from my perspective as a midwife, I've worked in both models. So I've worked in a busy public hospital where you do see a lot of people training. So when Annalise was saying fully qualified, you know, a lot of training programs are undertaken in public hospitals, big hospitals. So it doesn't mean that you're going to get substandard care, but it's a strong education focus. And all of these clinicians that are learning, whether they're students or registrars and in a training program, they're very well supported, but it is the model of training, whereas in a private hospital, generally people are fully qualified.
Exactly, we've all finished our training.
Yes.
To be able to work independently.
So. Independently, and that's where the term consultant comes from, is that they've finished their training, their final exams, which is how many years to complete?
Way too many.
A lot, a long time. So, you know, you should be very well reassured that anyone that looks after you in a private hospital has completed all of the training, but there's a lot of levels in a public hospital of supervision, so there's no one being crazy and rogue, but that is a part of the training course.
Yeah, absolutely.
And so, you know, you might have a doctor that's learning, or you might have a lot more student focus, which is great for all of our people coming out. In the public system, you also are discharged very quickly. At the moment, there's a lot of change happening in how quickly people go home. In some cases, they're really encouraging you out between 4 and 24 hours, which, you know, when you're here in a private hospital, 4 to 5 days is quite a difference.
It's hugely different, yeah.
And so that doesn't mean that you're kicked out the door and good luck with that. There is support that comes to you at home, but obviously that support comes once a day or once every second day. So there's a lot of times in between where you might have to call up and get advice, or you have to kind of pad through things yourself, which for some parents, especially if they're feeling really overwhelmed and anxious, is too much for them. And that's why, again, yes, being a private patient does cost more, because you're paying out-of-pocket costs. But you're kind of paying for that reassurance and support.
Yeah, absolutely.
That's not, you know, obviously if you were unwell or the baby was unwell, they're not going to send you home from hospital in the public sector. But if everything looks good, even if you're feeling anxious and you want to stay, they're still going to say bye-bye and send that support out to you at home. Which, you know, in a private hospital, our focus is to support parents, so the dad and the mum together, to learn what to do with their baby together. That's why we encourage dads to stay in. That's why we do a lot of education with the mum and the dad together, so that they're both getting that knowledge and that on-the-job training in that first few days in hospital. And I guess as a midwife in a private hospital, we do encourage that education. So if you're a big Italian family, we're going to be like, it's time, for everyone to go home, because we need to do a feed, or we need to help you to learn something, because that is the reason why you're staying in for those extra few days.
Absolutely.